Like Mouseketeers count off. Welcome, everybody. Thank you so much for joining us today. This is Carrie from the Ohio Department of Higher Education. It's great to see so many people returning from the first webinar on our Campus SART series. This is part 1 of 2. If you missed the first webinar and would like a copy of that recording, or we are recording this webinar today as well, so if you'd like a copy of this recording or both, just email me directly after the conclusion of this webinar today, and I will be happy to send that out to you as soon as it comes up in WebEx. I ask that if you have not already muted your phone or the WebEx application from which you are listening in on today, please do so. As I mentioned, we will be recording, so that will minimize any disruption or any information you are talking about not to be shared with others. As well as if you have any questions throughout the presentation, the chat room on your WebEx application is the best place to enter those questions. You can send them directly to me or just to everyone, and I will make sure to relay those to the presenters at the appropriate times throughout the presentation today. We're thankful to have such a robust, wide group of presenters on this call to you, and props to both Chandra and Ann for really reaching out to our community partners and our campus partners who are doing great work to elevate our campuses and the work that they're doing to better engage their, not just their campus community, but the wider communities involved, especially when it comes to the work with our campus response teams and whatnot. So thrilled to have Dr. Alicia Schroeder from Sinclair Community College and Charlotte Powell from Lourdes University on the call today to share a little bit about the work that they are doing, some of the work they have done, and definitely how it can maybe be transferable to your campuses today. So without further ado, I will be quiet and turn it over to our team today. So whoever's kicking this off, the floor is yours.
Okay, I think that actually may be me. This is Alicia Schroeder from Sinclair College. Just a little bit of background. We are a community college. For those of you that don't know, we're located in Dayton, Ohio. And we have about 22,000 students at our Dayton and other branch campuses. We have 3 regional campuses. So just to give you a little history of our college. I'm going to talk a little bit today about our Sinclair CAESV branding and outreach. Carrie, could you put us on that slide there? Okay, perfect. So Sinclair CAESV, this actually is a branding that we started in about 2016, and this came from a conversation that we were having about all of the different things that we needed to get out to our students that were compliance related. But we wanted to do this in a more meaningful manner. We didn't want to just make this a checkbox kind of thing. So we thought, how can we get this to students? So students are going to get all the information they need in a meaningful manner, and also show our caring culture that we really value here at Sinclair. So what we did was actually sort of package these into one communication, one sort of outreach thing, and it combines several different offices. If you could advance the next slide there, Carrie. Thanks. So if you look at this is one of our flyers that we hand out to students, faculty, and staff. And this just goes through what Sinclair CAESV means. So each letter of CAESV represents a different area of the college. C is for the Code of Conduct, which is our Student Judicial Affairs Department. A for the Advocating for Student Concerns, which is our Ombudsman Assistance process and our Student Complaint process. Third is our Responding to Needs, which is Accessibility Services and Counseling Services. E is Education on Prevention, which is intervention and outreach related to suicide awareness and prevention and our drug-free college policy. And lastly is S, which is our Sexual Violence Prevention and Response related to Title IX. And the interesting thing that I think has come from this is we've used this to do a lot of outreach, combined outreach to different populations in the college, whether it be students, faculty, staff. We've done outreach tables, flyers, emails. There's a web presence about Sinclair CAESV. And the interesting thing is many times when we get emails from faculty now, they'll say, hey, this looks like this needs to be a Sinclair Cares team outreach. So I think the word is actually getting out, and it's encompassing all these efforts. It also has allowed all of these different programs to really collaborate and build supports around students too. So for example, many of our students that may have a Title IX issue will be immediately connected to our counseling office, and that may also lead to connection with accessibility services because maybe there's a long-term need for accommodations beyond just the Title IX accommodations. And then they could also get involved with the Ombudsman office to look at some advocacy for that student beyond what the other officers are supporting. So it's really helped to develop a real collaborative relationship between all those departments as well. And in another area that we, just sort of grows upon the Sinclair Cares model is our college collaboration with our monthly Title IX cross-functional team meetings. And we have these every month, and this includes representatives from Student Affairs, our Title IX coordinator and investigator, Campus Safety, which is our campus police department, our general counsel, we have faculty representation, ombudsman, and our conduct officer. And we meet monthly to sort of keep abreast of the latest Title IX issues on a global scale, but also maybe look at trends or areas that maybe we need to focus on in a college. Are there areas that we need to do more outreach? Or there are certain issues that we're seeing repeated more often that we really need to dig in and see what's going on there. So it really allows us to all talk and keep on the same page and help support our students. Okay, and something else I'm very excited that we were able to do and just earlier this year, in February of 2019, we were able to sign a MOU with our local White Crisis Center, which is the YWCA. For quite a few years, we've been referring students to there when appropriate. Our Title IX investigator was referring students, counseling was referring students. But this really just solidified that partnership and is allowing us to work closely together. We have a direct referral system now with contacts for students and employees. They collaborate with us for education and outreach here on campus. We have their materials in different locations on campus as appropriate. The YWCA so far this year have been involved in many different campus events. They were involved in our Welcome Week. They had outreach tables at several different Welcome Week events. We've listed the YWCA on some of our flyers and pamphlets. They're on the website as a resource for students. And probably where we're utilizing this connection the most is direct referral to students by the Title IX investigator and counseling. Next slide. And just to go into a little bit of awareness and prevention work that we're doing here on campus, we had a very robust Sexual Assault Awareness Month agenda for April of this year. That included a lot of different activities. We had an LGBTQ presentation that focused on sexual violence within the LGBTQ population that was done by Equitas Health. We collaborated with local university partner, University of Dayton, and the Take Back the Night walk. We had a lot of outreach tables for Green Dot, and also our Title IX investigator partnered with our counseling services office and offered outreach tables around campus and at our regional centers as well. And then we worked with our theater department to do several performances of the Vagina Monologues, which was very well received by campus. And actually the YWCA partnered with that as well, and they had outreach tables at all of those performances as well. And then we sort of tied up the month with sending out our Changing the Climate Campus Culture Benchmark questions via email. All right, and lastly, and definitely not least, though, is we've done a lot of work with bringing Green Dot to campus. This was initially rolled out in 2016, 2017. We're averaging about 15 to 20 tabling and awareness activity per year. We're doing a lot of trainings, and to date, we have actually been able to engage about 750 students with the Green Dot program. And our goals for this year is just to continue to expand our work in Green Dot. We're partnering with the theater department again this year, and they are going to be doing a performance of the show it's actually called Slut, and that Green Dot is going to be involved with doing some outreach in that as well. And I think I'm not going to go into Green Dot too much because I think that Ann may be talking about Green Dot a little bit later in a little bit more depth. Is that correct, Ann?
Yeah, just a little bit, sure.
But that's sort of a overview of where we are at Sinclair to date, and we're continuing to review our process and continue to grow where we need to as well.
Thanks, Alicia. And Charlotte, before you start, I just wanted to kind of just do a little bit of an overview. Today's collaboration webinar isn't just the highlighting of the work that's being done. First of all, it's awesome. Secondly, it kind of gives you an overview of what's being implemented, but also where we can move towards as far as collaboration. And these are two prime examples, and then I will kind of go into like separating what awareness and prevention is to go a little bit deeper. Charlotte and I have worked together in the past, and so I wanted to highlight Charlotte's work as a whole kind of a community campus response. So Charlotte, you can go ahead and introduce yourself. I just kind of want to intervene and go over like this bigger, broader picture of why we wanted to connect today and collaborate on prevention and response for survivors. So go ahead, Charlotte.
Okay. Hi, I'm Charlotte Powell. I am from Lord University. I am the project coordinator there of a Department of Justice grant that we received last October. So we're finishing year one of a 3-year grant. I see someone from Tiffin University on here. They're going to recognize that because they received the same grant. But as part of that grant, one of the requirements is that you have a coordinated community response team. And so we began that process last October, and as you can see on the slide, it began with 6 core team members. Our Title IX coordinator, who was actually the person who wrote the majority of our grant application, so it's wonderful to have her on board. The finance chair, Dean of Students, Residence Life, Dean of Residence Life, Rape Crisis Campus Advocate. Much like Alicia, we have a memorandum of understanding with them as well, and as well with the Sylvania Police Department here in our area. So it started with them. I wasn't even part of this originally. I got hired in several months later and became the 7th member of the core team. And this core team met and, as part of the grant, knew that they had to create this team, and the 6 of them simply couldn't do all of the work that would be involved in the grant. So we began the brainstorming together, which is the next slide, of who do we need to have on this team? Who's going to, who are our important stakeholders, the people that we really need to buy in and have support? We're fortunate here at Lord University, the president of the university is an active member of our committee and believes wholeheartedly in the work that we are doing, and so much so that it is training the board of directors here at the university on all of the same stuff that the staff and faculty and students will be getting. So we have wonderful buy-in there. We brainstormed about what community partners do we need. The grant covers sexual assault, dating and domestic violence, and stalking. So what community partners could we bring in that would help us provide resources and services for anybody affected by those things? We wanted a diverse response team, and diverse in both race, ethnicity, gender, gender identity, sexual preference, all of those kinds of things, which was an interesting conversation along the way, because those aren't questions that you necessarily ask people out loud. You know, hey, can you represent the team for this? So that took some interesting conversation to figure out who we would have on the team that would best help us with all of those. Longevity, we're a small university. There's lots of turnover each year, so we wanted to make sure that the people that we brought on the team were people who have and will continue to have longevity. They weren't the only people that we invited on the team, but we wanted to make sure that when this grant is over, that we have some kind of sustainability and buy-in. Who could we have on our team that was going to increase buy-in? And obviously, if you look at our next slide, here we are, 7 months later, we have almost 30 members on our team. When we were doing that brainstorming, we knew that we had to involve students on this team, because without the students, which is what the campus is about, we couldn't have buy-in. So we have students, diverse campus members, including marketing. It was so important for us to pull in the marketing people. Much like Alicia said, we have branded what we're doing on campus. Ours is called One Together, Gray Wolf Nation, and we use that on anything that we put out for the campus so that everybody understands it's coming from this grant initiative. It's fighting against those particular things, sexual assault, dating, and domestic violence and stalking. So when they see that One Together slogan, they understand what it's about. It's on everything that we do, every email that goes out, all of those kinds of things. So, and marketing does a wonderful job with all of that. It's also included on the social media that marketing is in charge of. So some of our community partners, all of the local police, plus our campus security, the local domestic violence shelter, the Rape Crisis Center, which are both housed through the YWCA, but they have different components to them, so we consider them 2 different members. We have the Board of Developmental Disabilities involved to make sure that we are reaching those people with disabilities on our campus. We're working on also including the Department of Disabilities that's on our campus being involved in that, but it's basically one person who's in charge of all of that, and they wear a lot of hats. So we have a Sane from ProMedica who has joined our team and is a wonderful, wonderful, amazing resource. She does a lot of the trainings that we provide. Because we're a Catholic university that was founded by the Franciscan nuns, we have invited them to be on our team as well, and they have wonderful input, and they are wonderful to have there. The Sophia House, which is the local crisis and counseling center that's part of the university, but it's not funded by the university. So we have them on board as some of our services to victims as well. Part of the grant, what we did is for our our coordinated community response team, we divided into 5 subsections. So we have those people who are on the CCR team, and we have monthly meetings, much like Alicia said her group does. We also have those who are just part of victim services. So that includes the Domestic Violence Shelter House, the Rape Crisis Center, the Sophia House, which is the counseling center, the police department, the campus security. They're on that victim services piece. We have a prevention and education subsection. That's largely what I help with. That's kind of where my expertise comes in. Of the law enforcement and student conduct, which was really important to bring in, making sure they're looking over all of our policies, making sure they are inclusive, the language is inclusive, it's up to date, it meets all of the standards, because a part of our grant is largely focused on Clery as opposed to Title IX. They have very distinct requirements that are based on Clery as opposed to Title IX. So we have 5 major goals that we have included just in prevention, since I know this is a prevention-focused webinar, to train all new students on the topics of sexual assault, dating, and domestic violence and stalking. And we have lots of ways we're doing that. We plan to use an online component, which a lot of people do, but we know from best practice and research that everything needs to be ongoing if you want it to stick. So we have lots of things that we're going to incorporate along with that. One of being the bystander intervention program for the entire campus that's ongoing, so that includes faculty, staff, students, board of directors, the police departments, anybody who is involved on our CCR team will be trained in bystander. So we have our own program that we developed in coordination with the grant, and then we plan to be Green Dot trained. We don't have anybody here currently trained in that. We're using a program called Informed You, which creates discussions and a game-like environment for students. By itself, we would never use that, but as part of ongoing training, it's really wonderful. It was developed here in Ohio by some people in Cincinnati, so it's a really great program. The RAs are being trained to intervene. Part of our marketing that we came up with is a bystander pledge campaign. So after students and faculty and staff have gone through these trainings, they can then take the pledge, and we have sign-up cards, and we can use those as part of our marketing as well as, look how many people have signed up, look how many people care about this university and its safety. So we have part of that. Other goals that we have is creating an accountability system to ensure that we are reaching everybody. Some of that is built into the online component that we are using. Some of it is, actually creating spreadsheets with everybody's names and making sure that people have been trained and attended trainings. We're using the campus climate survey. I believe that'll go out in the spring to inform direction and needs. We've done that in the past, and that's what's informed what we're doing so far, and we will continue to use that. OEASB is providing that for us. Thank you, thank you, thank you. And training all of our responsible employees and the CSAs, which is the Cleary version of your responsible employees, campus security, local police, as well as, conduct personnel, board of directors. All faculty and staff are trained in trauma-informed care approach, which I feel is critical to know that and to have everybody trained in that. We're really excited that the local police were willing to be trauma-informed care trained. So that's kind of just an overview of what we're doing. We're at the end of year one, which was all creating the strategic plan, coming up with how we were going to implement it in the next couple of years. So we're really excited to get to the implementation part, which will start as soon as they approve our strategic plan. That's kind of where we are.
Thank you, Charlotte. And you're welcome, you're welcome, you're welcome. We are really excited to be working with you, shaping your campus climate surveys, and hopefully a lot of you on the webinar. This is Ann Brandon. I'm the Director of Prevention for the Ohio Alliance to End Sexual Violence. I think I forgot to introduce myself when I intervened after Alicia. Thank you both, Alicia and Charlotte. Very appreciative of sharing. I think it's really hard to share efforts on a kind of a statewide platform or an ODHE platform, because it's really scary, because we think that everything should be perfect if we're going to highlight. And the truth is that we're all striving towards prevention. So thank you very much for both of you sharing. I'll probably be pulling a lot of your touch points, both of you, about the things that we want to stress as far as how we have a community coordinated both prevention and response. One of the things that I do is I love primary prevention, so I'll kind of get on a primary prevention soapbox, but I don't want to overwhelm you when we're talking about coordination and collaboration of efforts. A lot of you have seen some of these things in ODHE webinars before, when Dr. Sharon Wasco and I are talking specifically about prevention, but it does really apply to a whole community response as well. So I'm going to go ahead and move to the next slide, Carrie. And my expanded image there. I always thought that this was who plays a role in prevention? And it has all of these really cool partners, but here's the reality, is every single person on the campus and surrounding the campus has a role to play. And I think that we can get really sidetracked by oh, that's the prevention folks, or these are the outreach folks, and we're the response folks. And that is true as far as kind of staying in your lane. But each one of us should have the skills and knowledge where if we solve something, that we can do something. So every single one of us should. Every single one of us on a campus, every campus community member, every student, every staff member should have pieces of the knowledge of prevention. So I'm going to move to the next slide. And I kind of want to do a little introduction, because sometimes we get really, sometimes the word prevention is used when something might be more outreach or awareness. Or sometimes we use the word education, which is fine too, but I kind of want to like talk about intervention and prevention separately. So when we talk about coordinated community response teams, or we talk about county CART teams, most of the time that is focused on the assistance and support of something or someone or a survivor after violence has occurred. So that's either a hospital response or you know, campus law enforcement or Title IX, or you know, kind of like the things that we do after someone has already been hurt by a form of violence. And prevention is really the thought process of how thinking about just like health disparities or any other disease that we have. Violence is an epidemic. So prevention is not only imperative, it is the heart of reducing the number of people that are hurt on our campuses. So these are the things that promote healthy environments. These are the things that reduce the likelihood of violence ever happening, or an incident or injury or condition from ever occurring, because we have done our work, we've done our research, we know these are the things that we compile to be healthy, and we know that there are things that we can do and messaging and skills and knowledge that we can implement that will stop someone from being hurt in the first place. So I'm going to explain this a little bit deeper. Some of you have seen this before, and obviously if you have a public health background or anything pertaining to health disparities, you'll know this pretty quickly. When we talk about primary prevention, that's really kind of where my focus is. Now, again, all of us collectively have maybe a secondary or tertiary focus on prevention, but primary prevention are really the strategies that are focused on sexual violence before it occurs. And some of those programs that we just talked about, that Charlotte and Alicia just talked about, are forms of primary prevention. So we'll be talking about that. Obviously, secondary prevention is really like what actually happens when someone is hurt. So that is really kind of like, oh, we're assisting victims, but we're also doing education about where to go if you've been hurt. So like that is kind of awareness, education of not necessarily a prevention message as far as primary. It is, but these are the things that we do, which is basically awareness. Take Back the Nights are awareness, but it's also where survivors are speaking. So that's not a primary prevention component or element, but it is part of a comprehensive prevention package. And then intervention treatment, which is tertiary prevention, is really providing the services, the counseling, therapy, healing, survivor mechanisms for the long-term effects of what someone has already experienced. We'll go to the next slide. So I can geek out on the river. I really can geek out on the river because I just love this analogy. It's kind of a public health analogy, but if you've heard it before, I apologize. And if you haven't, I'm going to geek out on it, and you can tolerate my geekiness. I think when I started in prevention, it was around 2002, and I really had no idea that what I was actually delivering in a middle school or high school was awareness. I was not delivering primary prevention. I thought if I talked about stats and if I talked about what to do, you know, about being hurt, or I thought if I talked to young men about, you know, not judging a survivor, about not judging what they wore, AKA rape myths, was primary prevention. Understand that those are not primary prevention. Those are awareness techniques. So what we were doing was kind of secondary prevention. And so when I learned about this kind of river model, it completely shifted my idea of primary prevention mechanisms. And if you think about it, it's basically about moving upstream. So this is really kind of the story of prevention. When you think about this, it's kind of like there are people along the river. Let's just say these people are fishing. I usually describe a man and a young boy, then they're fishing. And suddenly someone is coming down the river and they are struggling for their life. And the father and the son, they look at each other and they're like, oh gosh, we have to go help this person and make sure they don't drown. So they get this person out of the water, they bring him to the side of the river, they dry them off, they do whatever like mechanisms they need, CPR, they do that thing, they save their life, and then maybe they go to the hospital or go from there. But all of a sudden, there's a couple people coming down the river drowning as well. And so they just kind of keep pulling people out, putting them to the side of the river, helping them when they can, and then moving them into some other type of care or what we would call tertiary prevention. And the father and the son, they kind of think like, what is happening? That people are falling in the river. And that's what moving upstream is. It really is kind of thinking about why are people being assaulted? And then why are we only pulling people out of the river after they've been assaulted? That's all we're doing. And we're never actually going to stop it from ever happening in the first place if we just keep pulling people out and making people aware of how many people are falling in the river. We can give stats all day, 1 in 5, 1 in 5. If somebody's not connected to the issue and doesn't want to stop it themselves or engage in prevention themselves, we're going to continue to have those numbers. So moving upstream in kind of this public health model is finding out the reasons, primary prevention, of not only victimization, but perpetration. What are the risk and protective factors? What is messed up with the river that people keep falling in? So they go up the river, think about, oh, well, there's a bridge that has a hole in it. Like, what are the things that we can do to fix the bridge so people don't fall in the river? What are the things that we can do, the strategies that we can plan that will stop someone from being a perpetrator, having perpetrator-type behaviors, and or, becoming a victim as well. So we look at perpetration and victimization and primary prevention methodology, and we see that there are methods where we can fix the bridge on that. So if we go to the next slide, these are some things that we can do coordinated. Now, we're not asking you to do this as a response team. I just wanted to show you the things that do need to be aligned that you can help promote or you can help be part of, or do you have a prevention subcommittee within your CCRT? These are the things that when you develop a multi-strategy that can actually stop behaviors and norms around sexual violence. So when we think about it, social marketing, and social norms campaigns. These are things that like the It's On Us campaign. This is things that promote pro-social norms. These are that will activate someone to say, I care about this issue, and what can I do about it? So these are multiple ways to message. It's On Us is that campaign. These are like, they might be posters, they might be messages, it might be social media. These are pro-social norms. These are not posters that have a crying woman on them. So these are activating positive messages that says we're all part of this and we can do something to stop it. So we can talk a little bit more about that. Leadership development. Oh, I'm sorry, Carrie. Leadership development is basically kind of what Charlotte and like a little bit what we're talking about is what students or staff have influence over other folks on the campus. So you want to kind of do that leadership, those key stakeholders, the people who have influence to help with that messaging. Empowerment in general, which is student empowerment, also student leaders. How do we empower them to be messengers? Bystander intervention programs, we talked a little bit, I'm going to talk about that on the next slide, but that's important. Now, here's the deal. You cannot have a 1-hour, one-time educational program that talks about bystander intervention. You will not have the outcomes that you want to actually create an engaged or confident bystander. If your bystander intervention programs are either online and or it's a 1-hour session or a 10-minute talk about direct, distract, delegate, that is not primary prevention. The outcomes and evidence shows that you must have build in the confidence, the competence of a bystander, and it takes more than 1 hour. When we talk about engaging men, we kind of like check this off like, oh, we just need to go to men and tell them, not to perpetrate against women. And when we talk about engaging men, we're talking about men are survivors, and to acknowledge that, and then inviting men into the movement by just saying, hey, we know you, like, we care about this issue, we need you to be part of it to actually change the culture on this campus. Remember, only a small percentage of people are perpetrators. That means men as well. So we can't just come into a room and start talking about men's violence against women. You're not going to engage men. Really important to around your community, around your campus, to do bar outreach, to talk about, there's a lot of bar trainings being, where their staff are being trained. It is important that as a community, we are using primary prevention skills to bars and bar staff. We have to be messaging in social media as well. All of our social media within our campuses need to be aligned. And I think I talked about youth-led ambassadors. So we can go to the next slide. So a few of the evidence-based bystander intervention programs, bringing in the bystander. Some of these programs that are built, some of these curriculums have social marketing and campaigns and strategies, capacity building within the curriculum. So for instance, bringing in the bystander not only has a training component, but it also has a social marketing component that helps you plan your social marketing messaging. In primary prevention, you do have to, when we're talking about changing attitudes, behaviors, and beliefs, if you just think about marketing in general, when someone hears a message more than 7 times, they're more willing to buy into the product or buy into a new behavior or thought process. Green Dot is a fantastic bystander intervention program as well. The thing about Green Dot is it doesn't ask people to be a super feminist, kind of like you've got to adopt every single thing about violence on our campuses, or those things. It just says, will you do something if you see something, and how do you proactively message that something? So for instance, when we're talking about like a proactive Green Dot, which is anything that you do that would actually stop violence in the moment, but not only stop violence in the moment, but how do you message like that this matters to you? So like that's, putting bystander information, like, or, calling someone out, but also like on your own social media, your campus's social media, asking about bystander questions, saying how do you support the movement, sorry about that, things like that. So the Green Dot in itself, it does have multiple components. Also Step Up, and then the MVP program, which is the Mentors in Violence program, is from the great Jackson Katz, which is a lot of those components were built into Green Dot as well. So those are these specific kind of like that's focused on men. If you are creating your own bystander intervention program, you must be really aware of the components for evaluation and not just throw stuff together. It needs to be evidence-based for primary prevention. So we'll move to the next slide. If you are involved in primary prevention, or if you are involved in any of these efforts, or if you're just going to support the efforts, it is important that we have outcomes that say that we are actually able to measurably show where someone's attitude, belief, or behavior is shifting in a positive way towards the idea that violence prevention is important and that everyone should be healthy and safe on campus. If you are evaluating by saying, did you like the room today? Did you like the trainer? That's not an evaluation. You have to show measurable differences. And so when we talk about this, you could even think about this evaluation for CCRTs. It doesn't have to be for primary prevention, but think about what is the outcomes that we want? We want, a person to actually be a competent bystander. There are risk and protective factors. There are questions that can be shaped for evaluation that will give you those outcomes. And it's okay, primary prevention or prevention theory, it takes time to shift attitudes, norms, and behaviors. So be patient with those too. So think about those overall strategies. Okay, we'll go to the next slide. This is really important. I've been in prevention since 2002. That's 2019. Even though I was connected to Green Dot, I was connected to the Green Dot High School Research Project with 90,000 pieces of data and 26,000 high school students all around the state. I'm deeply grateful for that experience, but there is no magic wand. You cannot just have one program and say that this is the program that's actually going to reduce violence. I cannot express this enough. When we're talking about this big picture where you've got response mechanisms, you've got trauma-informed training, you have you're training faculty and staff, you're not just focused on students, you're doing multiple things, you are still doing events, but everything is aligned and strategically planned. One program is not going to change the culture on your school or in your community. It's also important that we advocate. So let's just say, hey, Anna, I'm not going to be able to do all these primary prevention efforts. I just really need to focus on how we're responding at the hospital, or I just need to focus on how we're responding as a campus for our Title IX when people report. I understand that, but here's also the thing. If you have influence with people who make decisions, you cannot have one prevention and one advocacy position on campus if you have a larger campus, or even if you have a smaller campus. If you have someone on call 24/7 and they're delivering prevention messaging, if you wonder why you turnover, that's why you have turnover. You cannot be responding to the trauma of survivors and then coming in the next day and delivering prevention messaging. It will burn someone out. So really holistically, looking at a bigger picture of how to infuse and institutionalize prevention teams and advocacy teams. So I just wanted to kind of this is the big picture today. This is the big focus that we really want to concentrate on. So next thing. Okay, so we're kind of here okay, and I'm not necessarily involved in the primary prevention part of this, but what is it that I could do, or how could I support these? And I talked a little bit about the things that the other campuses, the things that Lourdes are doing, the things that Sinclair are doing, where they're really aligning these efforts, and that also spoke about cross-training. So when we think about that, that's really important, our law enforcement cross-training, or cross-training for partners on your own team. So do they understand the social marketing campaign? Do they understand why it's important that everyone's involved? Do we recognize the branding in any social marketing campaign? Like I said, in the river, if we continue to only have response mechanisms and then we're doing outreach, which is, hey, 1 in 4 on our campus will be hurt, or hey, we're doing a tabling event, we'll never ever reduce the number of people hurt on our campus. So help with any prevention efforts that you can. And again, your key partnerships and your decision making and the way that you do a budget could also help sustain, or if you have input for your campus budget as far as hiring positions, as far as resources to deliver and align all of the message. I'm going to go to the next slide. I think we get the team approach because that has really been talked about on our first webinar and probably throughout these webinars, and we keep talking about a team approach. But if you are a Title IX coordinator and you're in charge of prevention and you're in charge of response and you're the only person doing that work, it's overwhelming. And if you think about if 1 in 4 persons ever stayed at an institution for 4 years and had life-changing and health disparity disease, if they came from your campus and they will have a lifelong disease because they were on your campus for 4 years. And I'm saying those diseases are health problems attached to survivors of sexual and interpersonal violence. There are lifelong health disparities. There are lifelong things that happen to you and your health. You would do something about it. If it was a disease that you would have for the rest of your life because the student came to your campus, we would do something about it. I don't know if that's clear, but we cannot do this work alone, and we have to stop the number of people that are being hurt on campuses. And so it's really important that we do this as a team approach. I can't emphasize that anymore. I care about people that are being hurt on campuses. I care about people that are being hurt in our communities. And so it's really kind of like this collaborative effort that we all care about. Okay, let's talk about planning for a second. We'll move to the next. We have created, if you remember, in the original Changing Campus Culture trainings the first year, we put together, and I say we, it's actually the PERT team that came in, put together action planning sheets for an overall collaborative effort for not only CCR teams or not only response teams, but for prevention as well. So part of this is just a reminder of that, and then also I could possibly send out those as attachments as reminders. So as we move forward, this is for if you're developing a CCR team, if you're developing a prevention plan. So think about it in both avenues. Obviously establish the group and work together about what strategies you'd like to use, what are your goals, things like that. But also really engaging all of your other campus and community experts like your rape crisis centers and your domestic violence shelters for technical assistance. If you are not necessarily completely in it, this is a piece of your job which is very, very important, but they're experts. And so they'll be able to say, this probably may or may not be a message that would feel inclusive, or this may be harmful for someone who has experienced sexual or interpersonal violence. So just don't forget that as you're collaborating, you're creating this plan, that you do have experts in the field, and then make sure that you have kind of a detailed inventory of what offices are already engaged in prevention efforts. They should be on your team as well. If you have a subcommittee like Charlotte does of just prevention, that you're coordinating efforts, and then also list off who you'd like to include in the future. And I can send out a few of those action sheets. Where do we go from here? It sounds very overwhelming when we're talking about, hey, we're just still trying to put together a team, and that was a lot of information on prevention, or we have a team, but we kind of just meet about some of the issues that we might be having to responding. I understand that. I think that if this portion of it doesn't necessarily, say, I won't be doing primary prevention, but we are going to be connected to those secondary efforts. That's awesome too, but make sure that you're still connected to the primary prevention messaging that may be happening on your campus. So that full collaboration, that full effort what it does is, one of the things is what Charlotte says is, we're pulling data from our climate surveys. You will see the gaps in training, you will see the gaps in knowledge and understanding depending on the information you've collected. I know it's in the benchmarks, I know we're talking about trainings. You'll see where you really have gaps, and then you'll see where you're doing well. So remember that you have the data, use the data. You have experts, use your experts, and to reinforce the message of really kind of connecting, and each one of you are responsible, each one of you are part of promoting primary prevention, promoting prevention, and knowing what to do if you see something and you can do something. So I'm going to open it for questions because I left a big old 7 minutes. Anyone have any questions that they would like us to answer?
Right now there are no questions. I just wanted to remind everybody that if you're interested in that flyer that Alicia shared earlier at the top of the presentation about what the CAESV stands for, that is available at the same place where you logged on to this webinar on the ODHE website as a PDF that you can download that and review it for implementation on your own campus or something similar if you're interested in looking at that model a little bit more in depth. So I want to add that into the group as we wait to see if any questions come in. Charlotte, I know you talked about it, and Alicia, I know you guys do it. Do you want to talk just very loosely about just that point about climate survey data and how it is currently or has guided some of your efforts of your groups on your campus?
So we used all of the data from the campus climate survey in our strategic plan. You know, so for example, it might have told us, off the top of my head, I don't remember exactly what all of it was, but it might have told us that we had a gap in, gosh, I can't even think of an example right now. But it, like Ann was saying, it shows you where all of your gaps are, where you need to make up information. If I pulled up my plan, I could probably tell you exactly where we used all of that, but I know one of the gaps it told us about was diversity, that we weren't reaching a diverse group. We weren't even attempting to reach a diverse group prior to the survey. We didn't even know what our diverse groups were. And so now with some of the information that we get from that survey, we know that we're a diverse campus, but we also know specifically what that diversity is. So now our plan includes reaching the veteran population on our campus, reaching, underserved populations, which might include minorities, it might include those people with disabilities, any of those kinds of things. So that's guided a lot of what we've done just in the diversity piece.
Awesome. Alicia, anything you would add?
So just full disclosure, I'm actually new to my role, so I have I did get to review our survey results from last year, and we are planning to talk over those at our next Title IX collaborative meeting and talk about how we may want to readjust some of our strategies for outreach. So sort of similar to what Charlotte said, I think we will definitely be using this as part of our strategic plan. But I have to say that I'm pretty early in that at this point, so.
I'm sorry, I did know that, and forgive me for putting you on the spot. Fully acknowledging that you are new, I apologize.
That is completely okay, I understand.
Go back in time, Alicia. But to add to that, because we worked with Sinclair, Alicia will have a report that Dr. Wasco provided. And also remember that we kind of like, oh gosh, we've got to get out a climate survey. We have complete engagement in our process, but we provide technical assistance after you receive that report to not only understand it, but the recommendations for your particular and individual campus are in the report, but also setting up a meeting for that follow-up technical assistance so that when you are to submit a strategic plan, that you actually, one, have the data, and two, have the technical assistance of Dr. Wasco and myself to help with that. So I don't know if a lot of people took advantage of that last year. Actually, I do know. A lot of people did not take advantage of that last year. And so just remember that it's not just the climate survey is done. It is that you do have technical assistance after you receive your profile report.
We did, this is Charlotte again, sorry, we did use the data a lot in getting the grant, first of all, because you had to have data to show that you had need on your campus for this particular grant. I pulled up the grant strategic plan, and just as an example, and we cited you guys in here and everything. It says, according to the Changing Campus Climate 2018 Climate Survey results, and then we go through and we list, so for example, compared to other sexual orientations, fewer straight students experience sexual harassment, unwanted sexual contact, and unwanted sexual intercourse. And then we have on there, significantly fewer straight students than others had observed a situation they believed to be sexual misconduct. So using that, we know that we needed something that was going to address those people with varied sexual orientations, and that would particularly address that population on campus. And we've added that into our grant focus.
Awesome. Awesome. Well, not seeing any questions come through, I want to thank all of our presenters today. Thank you so much for joining us and for sharing your expertise and your experiences with our campuses here in Ohio. To those of you that are on the call, if you'd like a recording of this webinar to share with others or just to review yourself, you can email me directly, and I'm also should have the recording available for the first part of this webinar series. And then a reminder, I believe October 19th is the third and final installment of this series, and will feature another campus and some additional points regarding your campus response teams and whatnot. So thank you all. I hope you have a wonderful day and stay cool.
Thank you, Carrie.
Thanks, Carrie. It's actually October 16th.
Oops. I'll correct it now.
Thank you, Carrie.
Thank you all.
Thanks, Carrie. Thank you, Alicia. Thank you, Charlotte, so much.
Yeah, that was awesome.